Take a breath. Now imagine that breath leaking into a place it was never meant to go. That's not a metaphor. That's the reality of a bronchopleural fistula, a rare but dangerous condition that can turn something as automatic as breathing into a medical emergency. Most people have never heard of it. Many doctors may only see a handful of cases in their entire careers. And yet, when it happens, it can completely change the course of recovery, or survival. Today, we're diving deep into what a bronchopleural fistula really is, why it happens, how it's found, and why it still scares doctors despite all our modern medical advances. Stick with me, because this isn't just about anatomy. It's about what happens when the lungs break one of their most important rules. The invisible wall that keeps you alive. To understand this condition, you need to picture how your lungs are supposed to work. Think of your lungs like two soft sponges inside a sealed plastic bag. The airways, the bronchial tubes, are the pipes that carry air in and out of those sponges. Around the lungs are two thin layers of tissue called pleura. Between them is a tiny space called the pleural cavity. That space is supposed to stay sealed. Quiet. Empty. It's like the space between a window pane and its frame. You never notice it, because it's doing its job perfectly. A bronchopleural fistula forms when that seal breaks. An abnormal passageway opens between the bronchial tubes and the pleural cavity. Air that should stay inside the lungs now leaks into the wrong space. Every breath becomes inefficient. Every cough can make things worse. And the body is not built to handle that kind of betrayal. When breathing starts to fight against itself. Here's the unsettling part. Sometimes a bronchopleural fistula doesn't announce itself right away. In mild cases, a person may feel almost normal. No pain. No dramatic symptoms. The fistula might only be discovered when a scan shows air collecting where it shouldn't be. But when symptoms do appear, they can be frightening. Shortness of breath that doesn't improve with rest. A persistent cough that feels different, deeper, harsher. Chest discomfort. Fever if infection sets in. In severe cases, sudden respiratory distress. It's like trying to inflate a balloon with a hole in it. No matter how hard you blow, the air escapes. The lungs struggle. Oxygen levels drop. The heart works harder. The entire system feels the strain. And once that air leak starts, it often doesn't stop on its own. A rare complication with serious consequences. Let's be clear, bronchopleural fistulas are not common. Most people will never develop one in their lifetime. Even among patients who undergo lung surgery, the risk is relatively low. After a lobectomy, where one lobe of the lung is removed, the risk is about 0.5 to 1%. That sounds reassuring, until you look at more extensive surgeries. After a pneumonectomy, where an entire lung is removed, the risk jumps dramatically. Studies report rates anywhere from 4.5 to 20%. That's not a rounding error. That's a real, serious risk. And when a bronchopleural fistula develops, it often does so within the first 8 to 12 days after surgery, right when patients and families are expecting recovery to be moving forward, not backward. Acute versus chronic, timing matters. Doctors classify bronchopleural fistulas based on how and when they develop. An acute bronchopleural fistula usually appears soon after lung surgery. It can progress quickly and become life-threatening in a short amount of time. These cases demand immediate attention. A subacute or chronic fistula develops more slowly, often due to infection. The symptoms may creep in over weeks instead of days, making them easier to miss or ignore. Both are dangerous. They just play by different rules. And the longer a fistula goes untreated, the more damage it can cause. Why do bronchopleural fistulas happen? This is where things get uncomfortable, because the most common cause is something meant to save lives. Surgery. Operations for lung cancer are the leading cause of bronchopleural fistulas. Removing lung tissue creates surgical seams, and sometimes those seams don't heal the way they're supposed to. In one study, about 2.2% of people developed a bronchopleural fistula after lung cancer surgery. But the type of surgery mattered a lot. After lobectomy, the rate was 1.4%. After pneumonectomy, it jumped to 14.3%. That's a tenfold difference. The more lung removed, the higher the risk. Less tissue means less margin for error. When infection eats away at the lungs, surgery isn't the only culprit. Severe lung infections can damage tissue enough to create a fistula. Tuberculosis has long been associated with bronchopleural fistulas, especially in low and middle-income countries where TB remains more common. Even newer infections have entered the picture. There are documented cases of bronchopleural fistulas developing after severe COVID-19 infections, where inflammation and tissue damage weaken the lungs' natural barriers. Infections don't just irritate the lungs. They can slowly erode them. Finding a problem you can't see. Diagnosing a bronchopleural fistula isn't always straightforward. Doctors often start with a CT scan, which can reveal air leaking into the pleural space. It's like spotting smoke where there shouldn't be any fire. But imaging alone isn't always enough. A bronchoscopy may be needed. This involves guiding a small camera through the airways to look directly inside the lungs. It allows doctors to see the fistula, measure it, and figure out exactly where it's located. That information matters, because treatment depends heavily on size and position. A tiny fistula and a large one are two very different problems. The uncomfortable truth about treatment. Here's where expectations need to be reset. There is no quick fix for a bronchopleural fistula. Treatment depends on multiple factors: how sick the patient is, how big the fistula is, and whether infection is present. Often, the first step is chest tube placement. A tube is inserted into the chest to drain air and fluid from the pleural space. This doesn't fix the fistula, but it prevents pressure from building up and buys time. If infection is involved, broad-spectrum antibiotics are critical. An untreated infection can turn a bad situation into a deadly one. In many cases, surgery is needed to close the fistula. This might involve open chest surgery or a less invasive approach using bronchoscopy tools. The goal is simple in theory: seal the abnormal connection, but difficult in practice. And even after treatment, close monitoring is essential. Recurrence is a real risk. The part no one likes to talk about: mortality. This is where the conversation gets serious. The reported mortality rate for bronchopleural fistulas ranges from 18 to 67%. That's not a typo. When deaths occur, they're often due to respiratory distress syndrome. The lungs simply can't keep up with the body's oxygen demands. Certain factors increase the risk of death: larger air leaks, delayed diagnosis, and the need for mechanical ventilation. Even when treatment is successful, recovery often means a long hospital stay, multiple procedures, and constant vigilance. Why outcomes vary so widely? Not all treatments work equally well for everyone. For example, bronchoscopic management, the less invasive approach, has reported success rates ranging from 30 to 80%. That's a huge spread, and it reflects how unpredictable these cases can be. Early detection helps. Smaller fistulas are easier to manage. Patients who are otherwise healthy tend to do better. But there are no guarantees. A bronchopleural fistula is a reminder that the lungs are both resilient and fragile, and that healing doesn't always follow a straight line. The bigger picture. Here's the hopeful part. The overall incidence of bronchopleural fistulas has decreased over time. Better surgical techniques. Improved treatment of tuberculosis. More careful post-operative care. Progress matters. But rarity doesn't equal insignificance. For the people who experience this condition, it's not a statistic. It's a lived reality, one that can redefine recovery and test every reserve the body has. What this condition teaches us. A bronchopleural fistula isn't just a medical complication. It's a lesson. It reminds us that the body depends on boundaries we never think about. That healing is a process, not a switch. And that even the best medical interventions come with risks that demand respect. Breathing feels simple, until it isn't. And when something disrupts the quiet agreement between airways and lungs, the consequences can echo through every system in the body. If you or someone you care about is facing lung surgery or recovering from a severe lung infection, awareness matters. Questions matter. Early attention matters. Because when it comes to the lungs, small openings can lead to big problems, and catching them early can make all the difference. Thanks for staying with me through this deep dive. If you found this helpful, stay curious, stay informed, and never underestimate the power of understanding what's happening inside your own body.